It's one of the most vital parts of your body, critical to your nutrition and overall health. Without proper care and maintenance, it can become unsightly and offensive and increase the potential for disease that can threaten your very life. It allows you to express yourself in a variety of ways. As a last resort, you can even use it for self-defense. Know what it is? It's your mouth. When it comes to the health of your mouth and body, your dentist should be one of your best lifelong friends. On the Wellness Spotlight today, I'm delighted to present a dentist's dentist from East Brunswick, Dr. Richard Rollman, who will share his knowledge on how a wellness lifestyle includes proper dental hygiene at every age of life. Dr. Rick Rollman, welcome to the Wellness Spotlight.
Thank you, Ken. It's a pleasure to be here. I've been a fan of your show for a long time and also a fan of you personally and professionally. I see what you do around the town, and most people maybe aren't aware of all you do for East Brunswick, again, professionally and also philanthropically. So it's my pleasure to be here.
Thank you, Rick. This concludes, Rick, tell us a little bit about yourself. Where are you from originally, and where did you go to school?
Sure. I grew up in Cranford, New Jersey, which is not too far away. It's about 25 minutes away. I went as an undergraduate to the University of Pennsylvania, where I received my degree in biology. After that, I went to NYU College of Dentistry, and then I came here to Middlesex County, and I did my residency at Robert Wood Johnson, a one-year residency. After that, I became an attending on staff. I was asked to be an attending, and I also worked part-time up in northern New Jersey for a prosthodontist in Livingston. In 1985, I was asked to take over the residency at Robert Wood Johnson, and I did that for 18 years, and it was immensely satisfying and rewarding, and I made a lot of contacts. I worked with some of the top practitioners, dental and medical, in central New Jersey. So again, for me, I grew tremendously professionally from doing that. In 1990, I teamed up with Dr. Joseph Shapiro, and we opened up a practice in January of '91, and we've been actively working in East Brunswick ever since then. So it's almost 21 years.
And where is your practice located in town, Rick?
It's on Cornwall Drive in East Brunswick. Most people know it as where New York Sports used to be, but it's no longer there, but not far from the post office.
Okay, and what was it that made you become a dentist? I know most people hate to go to the dentist. What drew you into the profession, and do people, have their feelings changed about going to the dentist now compared to the way that it was when we were kids?
Be glad to talk about that. When I was growing up, both of my mother's uncles were dentists. So I enjoyed going to their office to watch what they were doing. I did not like it at all being in the chair. It was probably my least favorite place to be. The sound of the drill used to make my skin crawl. And up until the day that I entered dental school, I wasn't sure if I could get over that. I thought I'd have to have earplugs to become a dentist. Things have changed tremendously from those days, as far as techniques go, as far as the equipment goes. I enjoy working with patients that are phobic, as a matter of fact, because again, I was phobic. I no longer am phobic. But again, it's a different era. In the old days, I still have many of my fillings that one of my uncles placed, and he passed away in 1975. He placed some very large silver fillings because in those days there was a theory, it was called extension for prevention. So the larger the filling, it was felt you would not then get decay in the tooth. That theory was proven absolutely wrong, because here we are in middle age, and a lot of those large fillings, they break. And then when they break, we're destined to more invasive treatment. So again, I love the practice of dentistry. It was the right decision for me. When I wanted to be a dentist probably ever since I was in first grade. My friends, we would play outside, and in those days, my friend Martin wanted to go into the military, my friend Chrissy wanted to be a fireman, and my friend Neil wanted to go into the police force, and I said I want to be a dentist, and we actually all did go into those fields, and I'm very glad that I did. I happen to love the profession.
Now, dentistry today, how has it really changed from dentistry the way that it was, say, 15 or 20 years ago?
Okay, again, the materials are much different. I take a tremendous amount of continuing education, which you have to do. I mean, by law, you have to take a certain number of classes. But the materials are different, the techniques are different. Now, again, I mentioned about extension for prevention. It's exactly the opposite now. You want to create, if there is decay, you want to create the smallest opening so that the natural tooth is much stronger than any filling that you're going to place in it. So the whole theory is different. We have implants. Years ago, if someone lost teeth, they were destined to wear a partial denture or a full denture. Today, with implants, you can give them function, which they couldn't have before. So again, the whole theory is different. We now look at prevention. Back 15, 20 years ago, we were looking at treating disease. Now we're looking really more at treating health.
And it's your expertise in this area that really drew me to ask you to be a guest on the program, Rick, because wellness is really what most people are looking for these days. It always, if you're not making time for wellness, then you're going to be making more time for illness. And I think the dental profession is the one profession in particular that's done the best job of being able to teach people about that and the whole value of regular ongoing checkups. When should a person first go to the dentist or be concerned about dental hygiene?
Okay, dental hygiene starts at a very young age. When the American Dental Association recommends 3 years old for your first checkup, there are numerous pediatric dentists who recommend even 2 years old. I always inform the parents of the children to look in their mouth. Do they see anything that looks to them to be unusual? Are there dark spots? Is there chipping of enamel? Does anything just not look right to them? But again, usually in my office we'll recommend by the age of 3, because at that age the child should have a full set of primary teeth. We look to see is the spacing correct. There should be spacing. Unlike permanent teeth, you want to see them right next to each other. With primary teeth, you want to see spaces, because the permanent teeth that will then come into those, when those teeth are lost, permanent teeth come in and they're just much larger. So you want to look at, the child's growth and development. And if I have any questions, I will refer the patient to a pediatric dentist.
Now, even though a child's primary or baby teeth are in, it's still important for the parent to make sure that that child starts to develop habits of dental hygiene. What are some things that you recommend parents do with their babies?
Okay. I'm going to go a little bit ahead, and I want to just mention about brushing. Okay. Because obviously that is where, when people think of dentistry, you think of brushing, you think of flossing. Brushing is a skill, and most children do not have that skill. So I've heard numerous parents who say, here's a toothbrush, go in the bathroom and go brush. However, there's a rule of thumb that we always say is that the skill, it's a fine motor skill to brush. And children, when they can print their name neatly, they should have acquired the skill to brush.
That's interesting. Okay.
Yeah, and it's very true, because again, it is a skill, and a lot of people can't do that. So, we will counsel them on what foods to eat. the children, because there are times to eat certain foods, and believe me, with my children, we cheat more than I'd like to, but I make sure that they brush their teeth in the morning and before they go to bed. Those are the two most important times to brush your teeth, specifically before you go to bed. But we will counsel them on the presence of decay. If we see someone, especially in this area has fluoride in the water. If they come in and there is a lot of decay, we'll investigate it a little bit further. We'll ask them about their eating habits, their snacking habits, their oral hygiene habits, and we'll counsel them on that.
What do you recommend is the best toothbrush for somebody, or does that change depending upon whether you're talking about a young person versus somebody that would be middle-aged and then somebody much older?
Yes, it does change. A pediatric toothbrush is certainly much different than an adult toothbrush in size and shape. Today, what's in vogue is a soft nylon brush. When we were youngsters, it was a hard brush. And
you used it to clean the grout in the shower when you were done.
That's exactly right. It was very abrasive, and then after years and years of brushing like that, we would see erosion of the teeth and the gums. Then it switched to a medium brush, and still we saw the same thing. Now we're using a soft brush. For many patients, again, even the choice of a toothbrush is a personal decision. We'll recommend electric toothbrushes, and there are several that are very good. They're very efficient, more so than a $5 spin brush, but it will massage the gums. It will effectively clean. They make all different types of claims about how well they can clean between the teeth. I'm not sure about that. I still recommend flossing, but we will notice in our patient population, people that have switched to an electric toothbrush, their gums are just tighter and more fibrotic, and that's what you want to see. You don't want to see the bleeding.
I see. And would you mind sharing who you feel would be the best manufacturers for the electric brushes?
Sure. Braun and Sonicare, even though I didn't really want to mention any specific brands, but those two are the leaders in the market. They both make a great brush. What I would do is go to your local discount warehouse and just see where you can get the best price on those. I have to stress also that there is a time when the brush no longer works, whether it's a hand brush or an electric brush. When the bristles are splayed, they're no longer cleaning. And some people in my office will give out a toothbrush when people come in every 6 months or every 3 months. A brush for most people will last maybe 2 months. So for 4 months, it's really not effective.
How often during the day should a person brush their teeth?
Okay, there's ideal and there's realistic. Again, the most important time to brush is before bedtime. While we're sleeping, we produce much less saliva, and saliva has a buffering effect. We want to remove food that is clinging to our teeth, anything that's sugary, because bacteria will grow on that. It's called the substrate. So again, it's very, very important to go to bed with clean teeth. And I know, because I'm living in the same world, a lot of times we're tired. At night, you'd rather just go to bed, go to sleep, but it's worth the investment of time to brush and floss before you go to bed.
So you have bacteria. I'm sorry to cut you.
Yeah, I was going to say, so the ideal number of times to brush, the ideal is 3. Can everybody do 3? Probably not. But again, the most important time is before bed. But ideally, I recommend after breakfast and after lunch and before bed.
That's interesting, because a lot of people get up and the first thing they do when they go into the bathroom is they brush their teeth.
Right.
Then they go have breakfast, and then sometimes that's it until after dinner before they go to bed.
That's exactly right. There's different schools of thought. Some people say it's better to brush when you wake up in the morning. Some people say it's better to brush after breakfast, and it probably doesn't make much of a difference.
When we were kids, the dentist used to give us that thing you'd put in your mouth, and it would cause it to show the areas of red where you missed brushing.
Right, disclosing tablets.
The disclosing tablets. Do you still have those?
They still do exist. We rarely use that. It's just rare to use it. Some people do that. Periodontists might do that. It just used to really scare us when we were kids. Everything would just light up red. But the average person is not a good brusher. It is showing the truth. But most people don't want to get, the red dye on their shirt, so they don't use that.
So just a couple more questions about brushing, Rick, and then I want to move on to some other things. How long should a person brush for? Is it a minute, 2 minutes? Should they say, sing a certain song, happy birthday to you? Or, what's your suggestion on that?
That's a good question. The average time that people brush is probably 15 seconds. They don't brush too long. And there's no way they will cover all the surfaces of their teeth unless they don't have a whole lot of teeth. But you're looking at, a minute to 2 minutes. Probably not more than 2 minutes, but you can get an egg timer and just see, because 2 minutes is a long time. But that's the best way to efficiently brush. If you use an electric toothbrush, I just want to add, is a very powerful device. And some people can overuse an electric toothbrush, just like they can overuse a manual brush, but an electric toothbrush could lead also to wear of the teeth and wear of the gums. So you have to be careful using that.
So if you're brushing manually for a minute to 2 minutes, what would be the proper amount of time using an electric brush to accomplish the same thing?
Less, but again, everybody is different. It depends on how much pressure you're placing. You just want to make sure that you're removing the bacteria. So I'm going to evade that answer. It's very hard to say, but probably less than 2 minutes. I'm going to say that.
Why is the mouth such an important part of the body, Rick, and what does it have to do with your body's overall function? Most people think, if they don't have a cavity or if there's no pain in their mouth, that they're okay. But clearly, there's a direct connection between your oral hygiene and your overall state of health. And I'd like you to take a few minutes and speak about that.
Absolutely. That, as a matter of fact, is one of the number one, if not the number one, misconception about dentistry. People will say, I don't have any pain. Why should I see the dentist? I don't need to go. And there have been studies that in approximately 80% of the time where there are dental problems, there's no pain. And many times patients come in, they're not aware that there are problems going on, even if there are large problems going on. I saw a patient yesterday, as a matter of fact, who had a large gaping hole in a tooth. She had no pain. So pain is not always present, and it's usually a very, very late indicator that there is a problem. So again, not having pain obviously is good. It's a good thing, but it's not the end all. That's why we recommend patients do see a dentist at least twice a year, approximately every 6 months, just to make sure that if there is anything going on, it's small and it's easy to fix. There is a very large relationship between your oral health and your systemic health. This is the health of your entire body.
Yes.
We're seeing more and more in newspapers and magazines about periodontal disease, and periodontal disease is basically disease of the gums and the supporting bone, and that's an inflammatory condition. Patients who have a history of an MI, a stroke,
a heart attack,
right?
Myocardial infarction, a heart attack. Yes.
These are basically inflammatory diseases, and there is an absolute direct correlation between oral health and the health of your entire body. Patients who are in better oral health, you see many fewer problems with the rest of their body, including heart attacks and strokes.
Speak for a minute about that, Rick, please. What's the connection between the health of your mouth and the health of your heart?
Okay. Again, this has been proven in numerous studies. We've seen more about this in the last 5 years than ever before. As a practicing dentist, we felt anecdotally that that was true, because we have the luxury of seeing patients' medical histories, we're seeing their dental histories, and usually when you see someone with a clean mouth and healthy gums and no inflammation in their gums, for some reason they're healthier. You know, and why is that? Again, we felt that, but again, that was never proven. That was anecdotal evidence. But it's been proven in numerous studies, including by the CDC, that periodontal disease and inflammatory disease throughout the body go hand in hand.
Now, is that because in the gum, deep inside the gum, there's a very rich supply of blood, and if a bacterial infection occurs, you can actually get that infection to migrate from the bloodstream into different areas of the body. It can settle in the heart, and if the heart or the body is in a weakened state, it increases the susceptibility of the body to other problems. Is that basically how it works?
You hit the nail on the head. That's exactly what it is. There's a very rich supply of blood vessels, so when there is an infection in a tooth or an infection in the gum, it actually gets out into the blood system and it can spread. Before the invention of penicillin, about 1 in 20 toothaches were fatal, because they would travel throughout the body. They could go to the brain. You could get a brain abscess, and there are certain places where if someone has a swelling, it's a major medical emergency, and they have to see an oral surgeon immediately, or even a hospital ER.
So that's important. Brushing and flossing is not only to have a healthier mouth and a mouth that looks better and stays longer with you, but also it's going to protect your heart and other vital organs too.
That's absolutely correct. Also, we haven't even touched on is your quality of life. You know, by having a healthy mouth and healthy gums, you have a much healthier quality of life, because number one, you can eat all different types of foods. You know, we all get a lot of pleasure out of the food that we eat. Different textures of foods. Some foods take a lot of strength to chew. The average person chews with about 250 pounds per square inch of force. So we have no problem with our natural teeth chewing foods, getting nourishment from our foods, and getting enjoyment from our foods. Somebody wearing dentures, the most that they're going to exert is maybe 50 pounds per square inch. So that's a tremendous, it's about a 1/5 amount of force that they can exert. Patients who wear dentures, a lot of times, unfortunately, you might see them at a restaurant and they're chewing and chewing and chewing and chewing and chewing and getting nowhere. And also their diets are very limited. And usually what they're going to eat are a lot of carbohydrates, you know, not a lot of proteins, because proteins take a lot of force to chew.
So if you're chewing meat, it's harder to chew meat than it is, for example, cooked potatoes or things like that.
That's exactly right. And we know now also that a diet high in carbohydrates is a very unhealthy diet.
Right.
So again, that's a quality of life issue, and that's also a health issue. Patients with toothaches are not going to have the same ability to concentrate in daily life. They're not going to get a good night's sleep. That also leads to medical issues. It leads to cardiovascular disease, you know, by not having a proper amount of sleep. Children in school, when they have toothaches, they can't concentrate. You know, they might be put to the back of the room when, you know what, they just need a visit to the dentist to alleviate that pain.
Now, earlier, Rick, you had alluded to the right foods for kids to eat. What are some of the best foods for us to eat, and what would you say would be the foods that we should really avoid, especially from the standpoint of proper dental hygiene?
Okay, again, very good question. We like to eat a rich, well-balanced diet, where we can eat everything. And in moderation, we pretty much can. I don't tell, you know, my children they can't have sweets. But again, in moderation. What times of the day are best are during the day, not at night. I don't want them to have sweets at night. I didn't even mention baby bottle syndrome. Like I said, you don't want a young child who has a bottle, to go to sleep with a bottle, because they get rampant decay. People don't realize how much sugar is in milk, and when that sits on the teeth all night, that's when they get just rampant decay in all of the teeth. But as far as the diet goes, you don't want to eat, again, raisins before you go to bed. You don't want to have foods that have what's called a low clearance rate. Low clearance rate, you can have raisins during the day. There's nothing wrong with that, but you have to brush. You have to be diligent when it comes to that. You don't want to use your teeth as an instrument. You don't want to bite into things that shouldn't be bitten into, because you break teeth, and teeth break all the time.
What are some of the most dangerous foods to eat?
Some of the most dangerous, large Bavarian pretzels, bagels that are, 2 or 3 days old. People break teeth all the time. I have patients who come in every now and then. They say, well, I was just eating a piece of white bread and my tooth broke. And usually there's an underlying problem that they have ignored. So again, that's why I stress to go to the dentist. We try to be ahead of the cycle of broken teeth. We try to look at teeth, and when I practice, I wear magnifiers just to see detail that I might not be able to see just with the naked eye. And a lot of times you can pick up cracks. You want to fix those before a tooth will catastrophically break, and not all teeth can be fixed.
I know it's your attention to detail that holds you in such high esteem, especially within the community. I know a lot of people go to you, especially a lot of dentists go to you, and their families go to you. What is it that you feel really sets your practice apart from many of the other dental practitioners in the area that are also excellent practitioners?
Right. There are many. I just want to say that there are many excellent general dentists and also specialists. We're blessed to have many specialists in this area, and I use their diagnostic abilities to co-diagnose problems also. When a patient comes in, sometimes we don't know what the problem is. We will then refer a patient out to a specialist for their opinion also. I would say that my partner and I both, we communicate with our patients. We explain what's there. We will give them options depending on what they want, how they want to go about addressing their problems. I will tell them, if they say, what would you do, Doc? I'll tell them what I would do. The final decision is theirs. So again, I think we all can communicate very well in my office. I have a great staff. I love my staff. And it's an enjoyable place to go.
Whitening, not whitening, what should people do in a nutshell?
Okay. Whitening is something that you really need a dentist's advice to whiten, because not everybody is a candidate to whiten. Some people can actually do harm by whitening because not that they won't get a result, but if somebody has numerous bonded fillings, for instance, on their front teeth, if someone has crowns on their front teeth, they won't whiten. The teeth around them whiten, then all of a sudden they say, you know what, my teeth are all different colors. And those are people that probably should not whiten. Or there's a saying, you always inform before you perform. You explain to them that you can whiten, but you might not be pleased with the results, or you might want to change some of those old dark fillings because the whitening just doesn't work. And again, after time in practice, you get very good at knowing which people are candidates to whiten and which ones they should save their money. It's not going to work.
Dr. Rick Rollman, thank you so much for being our guest here on the Wellness Spotlight. We've really appreciated. The time has gone so fast, and you have so much to share. I'd love to have you back one day in the future to be able to talk more about this very important subject.
Thank you, Ken. It was my pleasure to be here too, and I hope that I've given your audience something to take home. And again, my advice is, as I stressed at the beginning, just because it doesn't hurt doesn't mean you should not go to the dentist.
Thank you.
My pleasure.
This concludes another segment of the East Brunswick Advisory Health Council's Wellness Spotlight. I'm Dr. Ken Friedman, President of the East Brunswick Advisory Health Council, reminding you that wellness works when you work it.